Can you get psychosis from edibles? Have you ever wondered if consuming marijuana edibles can lead to psychosis? This is an important question, especially as more people explore cannabis in various forms. Psychosis is a mental state that can include symptoms like hallucinations, delusions, paranoia, and disorganized thinking. Yes, it is possible to experience psychosis from consuming marijuana edibles. Marijuana edibles are food products infused with cannabis extracts. They often contain higher concentrations of tetrahydrocannabinol, the psychoactive component of cannabis. The effects of edibles take longer to kick in but can last longer and be more intense than smoking. This delayed effect can increase the risk of acute psychotic symptoms, especially for certain individuals. Several factors can heighten the chances of experiencing psychosis from marijuana edibles. First, having a family history of psychotic disorders or substance abuse can put someone at a higher risk. If someone has underlying mental health conditions, like schizophrenia or bipolar disorder with psychotic features, they are also more susceptible. The frequency and dosage of cannabis use play a significant role as well. Higher doses and more frequent use increase the risk of psychosis. With edibles, accidental overconsumption can happen due to the delayed effects, which can raise this risk even further. Young people, particularly males aged 14 to 24, are at a greater risk of developing cannabis-induced psychosis and subsequent schizophrenia. Other substance use and environmental stressors can also contribute to this risk. Research indicates that cannabis use, including edibles, can trigger psychotic symptoms in vulnerable individuals. It may even increase the risk of developing chronic psychotic disorders over time. The relationship between cannabis use and psychosis is dose-dependent. The more frequent and higher the tetrahydrocannabinol exposure, the greater the risk. If someone experiences psychotic symptoms like hallucinations or paranoia after consuming edibles, it is essential to seek medical evaluation immediately. Early intervention is critical, especially for young users, to prevent the progression to long-term psychiatric conditions. In practical terms, caution is advised when using marijuana edibles. Individuals with risk factors should be particularly careful. Being aware of the delayed onset and potency of edibles can help prevent unintentional overuse. Marijuana edibles can cause psychosis in some individuals, especially those with genetic, mental health, or environmental vulnerabilities. Understanding these risks is important for safe consumption.